Pulse oximetry is a way to measure the amount of oxygen in your blood with the use of a tiny device called a pulse oximeter. A pulse oximeter comes with a built-in probe. The probe attaches to your finger or toe with a clip. This probe emits beams of light that pass through the blood in your finger or toe to measure your oxygen level. This allows the probe to read the percentage of blood that carries oxygen. We call this percentage your oxygen saturation level, also abbreviated as SpO2, SAT, or SaO2. Normally, at least 89% of your red blood cells carry oxygen. Pulse oximeters also provide a reading of your heart rate or pulse. Times when a pulse oximeter reading may be helpful are when you begin oxygen therapy. This helps your healthcare provider know if and how your oxygen saturation level changes while doing everyday activities. During or just after exercising. Your body needs more oxygen when you are actively moving. Your healthcare provider might request that you check your saturation during activities to see if you have oxygen problems during and right after exercise. During a plane flight, or if you travel to a high-altitude location, some patients require increased oxygen at these times. Why is it important to check your blood oxygen level? If you have lung disease or when recovering from pneumonia, your blood oxygen level may be lower than normal. When your oxygen level is low, your body has a hard time working properly. Having a very low blood oxygen level can also put a strain on your heart and brain. If you are new to oxygen use, having a pulse oximeter will allow you to monitor your blood oxygen level and to know when to increase your supplemental oxygen flow rate. Make sure to ask your healthcare provider when they want you to use a pulse oximeter to monitor your blood oxygen level, such as during rest, during some common activities, or during and after exercise. You should also know the oxygen saturation level your healthcare provider wants you to maintain, such as greater than 90%, so you know if or when you should change the flow rate on your supplemental oxygen and when you should seek medical attention. How accurate is the pulse oximeter? The oxygen level from a pulse oximeter is relatively accurate. Pulse oximeters may give a reading 2% over or 2% under your actual oxygen saturation level. A pulse oximeter reading may be less accurate if a person has a cold hand, poor circulation, or when wearing nail polish or artificial nails. Some may find they receive a better reading if they place the probe on sideways or use it on their toe instead of their finger. A pulse oximeter may also be less accurate with very low oxygen saturation levels, below 80%, or with very dark skin. To get the best reading from your oximeter, you need to make sure enough blood is flowing to the hand and finger wearing the device. To achieve a better reading, ensure the hand is warm, relaxed, and held below the level of the heart. Be sure you see a consistent or continuous waveform, or count your pulse for 1 minute and compare the number you get to the pulse number on the oximeter. If they are the same, you are getting a good signal. If you smoke, the reading on the pulse oximeter may be higher than your actual oxygen saturation level. This is because smoking increases the carbon monoxide level in your blood. The oximeter cannot tell the difference between carbon monoxide and oxygen in the blood. Therefore, it is best not to smoke. At times, you may get an abnormal reading if the probe of the oximeter is not functioning properly. Take your pulse oximeter to your healthcare provider's office or the medical equipment company to have it checked against their devices for accuracy. Ask your healthcare provider to show you how to use your pulse oximeter to get the best readings. Be sure your hand is warm and the probe fits well. When you should use your pulse oximeter. When you should turn your supplemental oxygen up or down, and when to call your doctor or seek medical attention for low oxygen saturation. For tips to quit smoking.